Hello everyone, I am Sandrolene Rodam from Level 1C and we were assigned to the anatomy and physiology of the heart. The heart is a muscular organ that pumps blood containing the oxygen and nutrients the body needs. The heart is sort of like a pump or two pumps in one. The right side of the heart receives blood from the body and pumps it to the lungs. The left side of the heart does the exact opposite. It receives blood from the lungs and pumps it out of the body.
From the time when you were a child and throughout your life, your heart remains the size of your bowl of fist. Try to hold your hands in a fist and that's the size of your heart. The heart beats an average of 100 times a day. In your entire lifetime, your heart might beat up to 2.5 billion times.
The heart is located near the anterior chest wall, directly posterior to the sternum. A mid-sagittal section through the trunk does not divide the heart into two equal halves, because the center lies slightly to the left of the midline. The entire heart is rotated to the left, so that the right atrium and right ventricle dominate an anterior view of the heart.
So this is the anterior view of the heart, shows the four chambers, the major vessels and their early branches as well as the valves. The presence of the pulmonary trunk and aorta covers the interatrial septum, and the atrioventricular septum is cut away to show the atrioventricular valves. The base of the heart, the posterior part, it is formed by both atria but mainly the left. The anterior of the heart is formed mainly by the right atrium and ventricle, due to the twisting of the heart during development, which causes the left atrium and ventricle to lie posteriorly. The posterior view of the heart shows the permanent coronary surface vessels.
Now let's proceed to the pumping section of the heart. First is the right atrium. The right atrium receives the oxygenated blood from the superior and inferior vena cava. It also receives blood from the cardiac veins through the coronary sinus. Second one is the right ventricle. Blood travels from the right atrium into the right ventricle through a broad opening bounded by the right atrioventricular AV valve, also known as the tricuspid valve. It also pumps blood to the lungs through the pulmonary artery. Then the left atrium. The left atrium receives oxygenated blood from the pulmonary veins. Left ventricle. The left ventricle wall is much thicker than the right ventricle wall, enabling the left ventricle to develop enough pressure to push blood through the large systemic circuit, whereas the right ventricle only needs to develop enough pressure to pump blood through the nearby lungs.
In the heart, oxygen-poor blood flows from the body through large veins into the right atrium. Next, the blood moves into the right ventricle, which contracts, sending blood out of the heart to pick up oxygen from the lungs. Oxygen-rich blood moves out of the lungs into the left atrium, then moves into the left ventricle. Finally, the left ventricle contracts, sending oxygen-rich blood out of the heart to the different organs of the body.
What scenario actually happens in the cardiac cycle when the patient experiences heart failure? If the person has a heart failure, it means that the heart has lost the ability to pump enough blood to meet the body's needs. He or she may have weak or damaged ventricular walls that are not able to push enough blood out of the heart. He or she may also have stiff and thickened ventricular walls that do not allow the heart to fill with enough blood. Either scenarios are a probable cause of the patient having a left-sided ventricular failure. In addition, blood and fluid may back up in the veins that deliver blood to the heart. This can cause fluid to leak into tissues and organs.